What is complex PTSD? And if you think you might struggle with it, what do you do? Let's jump in. PTSD, many of us are more familiar of, can often be the side effect of a single traumatic event, whereas complex PTSD can often be the side effect of multiple or ongoing and chronic states of stress and traumatic events. So complex PTSD, if you start Googling it, is often associated with childhood. And while probably most of the time it starts in childhood, it doesn't have to. It can be related to ongoing traumatic events in adulthood as well. However, I do always encourage people to start looking at the childhood stuff because a lot of times there's more there than we at first realize. So how to know if this might be a problem for you. Some common symptoms might be not really feeling emotions, being kind of numb, or like in my case, I was like, I would always answer, I'm fine, I'm okay. And I meant it. I really thought I was. Or you might be emotionally flooded and emotionally reactive. If you ever find yourself going from like 0 to 1,000 like that, then there's some emotional flooding going on there. Body image issues, chronic health issues, anger issues, trust issues. Who doesn't struggle with trust issues? Maybe not trusting enough or trusting too much or trusting the wrong people. And how do you know if somebody is trustworthy? Those are some big things. Maybe you don't know who you are outside of your roles. When you strip away daughter, son, mom, dad, brother, sister, occupation, what's left? Who are you? Maybe you have missing memories. Maybe you experience some shame or guilt. Now listen, many of us experience many of these things. All of the perfectly, quote, normal, happy, healthy people will experience some of these things. So just because you check off some of the items on this list does not mean that you have complex PTSD. However, if this list really hits some, there's some deep resonance going on, then it might be something you want to further explore. If you have ever received diagnosis such as ADD, bipolar, eating disorders, anything like that, or any struggle with addiction or disordered, even if you don't have a full-blown addiction or eating disorder, if you struggle with disordered eating or abusing substances, even occasionally, then there might be some stuff to look at. And so what do you do? How do you look at it? Reach out to a trauma-trained professional and make sure, I wrote down a few questions that you can ask them because not all trauma-trained professionals are trained in the ways that you might be looking for. And so it's important to just have a little clarity on what it is that you're looking for. So some people can be trained in trauma and they know the red flags to look for, but maybe they're not trained to walk alongside you as a support and a guide. They just know what to look for, analytically speaking. So you want to make sure that first, they are trauma trained, they know their stuff, but also that they have been trained on how to metaphorically come sit down beside you and help you through these situations. And also, you're going to want to have some inkling on how do they take care of themselves? What is their self-care like? Considering that they're working with some pretty big issues, because we can experience vicarious trauma, just hearing other people's stories. And so when trauma-trained professionals are working with clients who bring some pretty big and painful issues to session again and again and again, the professional themselves is at risk of burnout and of having their own triggers triggered. So are they taking care of themselves professionally and personally? Now, you don't need to go asking the details of what that looks like for them, but just to have a general sense that they are aware of these dynamics and taking care of themselves so that when they are with you, they're just with you. And also, hurt people hurt people. So that's another reason that trauma-trained professionals are typically trained to take care of themselves, to work through their own issues. And if you, as their client, know that that's being tended to, you can feel safer knowing that they've got your back and they're sitting in the seat right beside you saying, yeah, I hear you.